Welcome everybody to the session which is called GHI 09 Healthy Living and Prevention. Thank you for joining us today. Before we start, I would like to make some points. Evidence exists that justifies actions to effectively address prevention, namely via a lifelong approach that starts early with children. We know also that the size of the challenges point to the need of being much more ambitious and possibly also innovative than in the past. It is also less difficult to develop such ambitious approaches by teaming up with other countries, building on best practices, avoiding mistakes, and sharing the burden. And also, we believe that this applies to all parts of the world. Supported by our member states' efforts, the European Union has just started to implement its new global health strategy. Today, I would like to stress one of its key objectives, which is to deliver better health and well-being of people across the life course. Our partners want us to focus on fundamental elements of health policy. This is why the European Union focuses efforts on strengthening primary healthcare systems, on achieving universal health coverage, on prioritizing women, girls, and the most vulnerable. We must equally tackle all determinants of ill health, including climate. We must mobilize all stakeholders in a coherent fashion, focusing on what each of them can best deliver. In this session, we have 4 distinguished speakers. We will first listen to all 4 interventions, and then you will have an opportunity to ask questions. So first the interventions, and after that we have a question and answer session. Okay. And just give me a second. I would like to start with introducing the first speaker, who is Michele Cecchini. Michele is responsible for the OECD program of work on public health, and among his many published work has addressed the economic issues relating to the economics of public health, as well as representing OECD on the board of the Global AMR R&D Hub. Among other things, he has served as temporary advisor to government and international agencies, including WHO, IARC, the European Commission, and the World Bank. Today's presentation, we are looking forward to it. The floor is yours, Michele.
Thanks a lot, Stefan. Hello, everyone. It's a real pleasure, personal pleasure, but also as OECD to be here with you and share some of the thought, participate to this lively event. Thanks to the Commission for inviting us, but also, of course, to the organizer of the World Economic Forum. So in the next few minutes, I would like to share with you some of the thinking that we are doing at the OECD on promoting healthy living and prevention. For those of you that perhaps are not very familiar with OECD, we are an intergovernmental organization, including 38 member countries, growing. Some of the countries are high income, but more and more we work globally. And one of the specificities of our work is that we focus on the economic issues. So from our point of view, healthy living is a health-related issue, but also a very economic issue. And I would like to share with you some of the numbers that show how healthy living is an economic issue, not only for high-income countries, but for countries at every level of income. Let's take an issue that very often is perceived as more an high-income issue, which is overweight, overnutrition, lack of physical inactivity in some cases. If we look at the diseases that are associated with this risk factor, they cost to the OECD countries around 8.5% of their healthcare expenditure. The number is very similar for countries at the lower level of income as well. In Mexico is 9%. Even in India or Indonesia, this represents around 6% of the healthcare expenditure. And if we think about the countries at lower income, countries in which there is lower use of safety nets, then we can think that most of the expenditure goes directly on the persons. It's not covered for the governments, social health insurance more in general. Overweight is also a development problem. some of our analyses show that children that are overweight are 10% less likely to finish their school. They are more likely to be bullied when they are at school. They have lower school performances. Lower school performances today for children means lower opportunities tomorrow to find a good job, to get a good salary, and at the population level means lower opportunity for this country to have a fit workforce, productive workforce for the future. Today, overweight costs around 3.5% of GDP to countries. In countries such as India, we are not far from the 3% of their GDP. Tomorrow, given the growing burden of obesity, we'll experience, these countries are likely to experience even larger burden on their economy. I focus on overweight and obesity, but the very same things can be said for many other risk factors, whether this is tobacco consumption, particularly in countries where there is lower level of enforcement for policies, whether this is alcohol consumption or pollution. A lot of the focus these days is really on pollution and environment. Countries at lower level of income are bearing most of the burden today for this. So the OECD kicks in at this point. In addition to trying to assess what is the burden, we also try to propose and support countries in implementing policies and best practices. So our point of view on what a best practice is, and this is something, an approach we have co-developed with member states and stakeholders, is an intervention that is effective. We want something that makes the difference. We want an intervention that doesn't change only things such as being aware of a problem, being sympathetic with the problem. We want something that changes the attitude and the behaviors of the persons, whether it's stop smoking, whether it is stop drinking or drinking more responsibly, whether it is having a healthier and more active lifestyle. The second thing that defines, in our view, a best practice is the extent of the coverage of this intervention. We want something, an intervention that is able to cover a good share of the population. Because changes at the population level, you can only see whether you're able to cover, perhaps with a mosaic of intervention, with a package of intervention, but a significant share of the population. Number 3, efficiency, which both include a concept of affordability. We want things that countries can pay. Some of the intervention that we see perhaps are costly for certain countries, but the vast majority of interventions that are best practices should be interventions that are very much affordable for countries independently from their level of income. And they should also give a good return on investment. For each euros, dollar, you can name the currency that you invest. We try to select interventions that have an order higher in terms of what they produce in terms of saving for the healthcare expenditure and the broader economy. Fourth, there is a concept of equity, which goes along with the concept of cost effectiveness. Based on our experience, there are some interventions that are extremely cost effective, but they tend to target perhaps people with higher level of education, because these are usually those that are easier to convince to change their lifestyle, while you need an extra effort, extra investment to modify the behavior of other population groups. Number 5, and last, I stop here, they should be feasible. In some cases, it's very easy to say, well, starting from the 1st of January 2024, we ban something. But is it really politically feasible to put this in place? Possibly it's something that will be very affordable, cost-effective, ideally effective, but there is a political process that goes behind. This is, in our view, how we define best practices, and that's what we do also in collaboration and with the support of the European Commission to support countries to transfer best practices from one area to the other and to put them in place. One important thing, and Stefan, tell me if I'm getting too long.
No, you have still more time.
Perfect, thanks. Is moving from the theory to the practice, the implementation of this intervention. It's very important, in our view, to make the case at the beginning, and that's to a large extent our work and our bread and butter, to make the case, as I said, to implement this intervention. But it's also very important, and we should acknowledge that many possibly of the most effective intervention and cost-effective intervention that countries can put in place fall outside the healthcare sector. Today, I'm sure that if I ask you to raise your hands, most of us define themselves a public health expert, specialist, and so on, while many of these interventions, and many of the interventions that, as in this community, some say no, that we can implement are outside the normal boundaries of our area of activity. As public health experts, we need to collaborate and establish partnership with many other governmental and non-governmental agencies. I'm thinking about colleagues working on education, Ministry of Internal Affairs, and so on. As a starting point, I'm a medical doctor specialized in public health, so please believe me when I say that I'm very much sympathetic and I grew up with the concept of health in all policies. I think we should try to go beyond the concept of health in all policies to make understand what other ministries can gain, what other governmental agencies can gain from having a healthier and more productive workforce. We need really to make the case for them to think, oh, if I do this intervention, that, by the way, has a positive effect on the health of the population, I gain something as a different ministry. Because I can have a more educated workforce, because I can have a more productive workforce. This is the reason why, more and more, I think that beyond calculating the health impact of an intervention, we should take into account what are the broader implications of an intervention. More and more at the OECD, and certainly is what is happening for the work on public health, we adopt a well-being framework. Looking at how different dimensions are impacted by public health intervention. I want to give you a very simple example. We are about to launch a new publication on how modifying the urban environment, redesigning our cities to be more conducive for active lifestyle, has an impact not just on the level of physical activity of the population, but also on things related, for example, to pollution, greenhouse gases emissions, and so on, which in a way can reap both benefits for the public health community, but other communities as well. Well, when we do the calculation of how this intervention, things such as bike sharing system, pedestrianizing some street as is done in Barcelona, for example, with the Superblock initiative around many other countries in the world, the vast majority of the global impact of this intervention is outside the healthcare sector. Still, the healthcare sector gain huge benefits from liaising and working together with other communities also to maximize the health impact of these policies. In many cases, just small tweaks in how the intervention is implemented can maximize the health impact of this intervention, even if this intervention is not funded, is not designed with health in mind, is carried out by another government. My last point, and I stop here then, is that more and more, I think, in the same vein, we should try to work thinking about the broader environment. It's not just a matter of a policy on tackling harmful alcohol consumption. It's not just a policy to tackle tobacco consumption rather than improving the lifestyle of the persons, but we should think more globally about the environment in which people live, and we should act on that front. And I think that the future, the near future, is really desilosying. Perhaps, I don't know whether the work makes sense, but breaking the silos, even in the field of public health policies, to go towards a more comprehensive approach. Thanks a lot for your attention.
Yeah. Yes, thank you very much, Michele. Yes, indeed, the always burning issue of political feasibility that stuck in my mind from your presentation. And if you have questions or suggestions or ideas, please note them down. There will be a possibility after all 4 interventions. and in particular, if you have ideas how we could improve political feasibility of specific public health interventions, those ideas are always very welcome. Yes, so with that, I come to the next speaker, that's Dr. Carina Ferreira Borges. She is Regional Advisor and Unit Lead Alcohol, Illicit Drugs and Prison Health in the WHO Regional Office for Europe. Carina is a public health specialist and holds a PhD in international health. She joined WHO in 2006, and among many areas covered, she was head of the WHO European Office for Prevention and Control of Non-Communicable Diseases and acting director providing strategic and technical support to the 53 member states of the region in scaling up their efforts to better prevent and control NCDs. She is also responsible for coordinating WHO support to the NCD Council, an initiative driven by WHO Regional Director to accelerate progress and innovation for tackling NCDs, coordinating the Signature Initiative on Health Taxes. The subject of this morning's presentation is NCDs and innovation. Carina, the floor is yours.
Thank you. Thank you very much, and good morning, and thank you for being with us. Thank you, Michael, also for Michele, for doing the economic argument, bringing this very important dimension to the topic that we are discussing here, and that at many times it's not valued by countries, by the policies that we see being put in place, and by the value of health, and how without health, we are not able to progress in terms of economy, in terms of development of the countries. I think that COVID-19, and we all talk about COVID-19, and we all talk about the lessons learned, with COVID-19, certainly has taught us that, this is something that has, health has to be, in the center of everything else, because if we do not have health, all the economy will be collapsing, and we certainly have seen the impact that we all suffered from the fact that we were all affected by this pandemic. When we talk about the healthy living and the work on prevention and the work that WHO is developing, I would like to start by highlighting, first of all, coming from the general perspective that heads of state have gathered together in 2011. To look at the progress that to look at how countries could implement and contribute to to a healthy living by addressing the burden of non-communicable diseases, and this being because non-communicable diseases are the major silent epidemic that countries face. They kill, in the WHO European region, every 9 out of every 10th death is related to non-communicable diseases. So if this is not a silent epidemic that is killing everybody, and yet for which we are not countries are not putting the attention on, then I don't know what kills more. But this is the silent epidemic. And it's there every day. And we know that one of the major things that can be done, and you brought that argument of the economic impact that this silent epidemic has in countries, is to prevent it. And it is because prevention can really change a lot of what we see in terms of the diseases that are now being dealt with in the healthcare systems. We know that healthcare systems are in crisis. I just came from a meeting in Gastein, and I was actually discussing that before we joined. And one of the major lessons and one of the major discussions that was happening in the European Forum of Health in Gastein was about, our systems, health systems being in crisis, and how are we going to make sure that we continue in the same model that Europe has chosen to have, for as ever, of solidarity, of supporting the people in need if the resources are more and more scarce. It's not just a problem of the systems and of the resilience of the health systems, of having healthcare providers that are there to do the work, that are there to support, when we need also the support of the systems. It's beyond that. It is about the model that we want to see. If, for example, we decide to privatize, all the public health systems that we have in place. And NCD is a major burden for the health systems. It is a burden that is not going to decrease. It is a burden that is going to increase. Look at cancer. Look at the impact that cancer has in the costs that the health systems need to provide, need to account for. So it will not get better. It will only get worse. And in the current environment that we are living, where member states are constantly faced with what we call the perma-crisis, the constant crisis. We have the climate crisis, we have the NCD crisis, we have the wars, we have the earthquakes, we have, just name it, every day we have, again, another crisis. And Europe is being faced with crisis after crisis. So there's a lot of competition into the attention of what the ministers, and in particular, health ministers, but not only that, finance ministers, their attention is just being, going left and right, what is the priority? What is the priority? But one of the things that we find is useful to look at what the priorities are in this perma-crisis is to look at, who are the most vulnerable when we have those crises? Who are the people that really are in a situation where if we have, an agenda that aims to serve, equity purposes, who are those people? Who are the most vulnerable? And when we look at this, it helps us also to look at what are the priorities, because those who are most vulnerable are usually those who have the less power, financial power, for example. You get sick, you don't have the funds, you cannot be treated unless you have a system that can treat you. And we know how this is getting, more difficult, right? So you have the power dimension, but you also have other dimension, which is, for example, the resources you have as a person. So, for example, as you get older, you will have less resources than a younger person. So you will be more vulnerable just by the fact that, we get older. And, the older we are, the less health resources you have. So we will be much more vulnerable in any crisis that is going to happen. And then the other dimension of vulnerability is linked to the chronic diseases, because we have seen this constantly in every crisis. And WHO has been at the forefront supporting the countries during the war in Ukraine, during the earthquakes, during now what is happening in the countries to whom we are assisting. And we see that people with chronic diseases bear the highest burden because they do not have the resources. They are extremely vulnerable. They are, after the acute care that needs to be provided in war, in all these crises, that those who are really vulnerable are those with the chronic diseases, because they have to have, another type of help, right? So all of this is, dimensions that where NCDs really emerge as early markers of vulnerability, and that really require, a shift in the way that we are thinking. If we look at the commitments of the heads of state, and I start, I go back to where I started, heads of states have committed to reduce premature mortality by 2030. And we are off track, linked to NCDs. And we are off track. We are not meeting those targets. We are going to have a new high-level meeting, UN high-level meeting, where we're going to look at the progress that has been made, so in 2025. And I would argue that time is our most scarce resource, because we have less than 100 weeks to be able to demonstrate that we have been able to progress in addressing the burden of non-communicable diseases. And addressing the burden of non-communicable diseases means that we have to address the risk factors as well. If we talk about healthy living and prevention, this cannot happen if you do not address those risk factors, the major risk factors. And Michele already mentioned, alcohol consumption, tobacco, physical inactivity. And one of the biggest burdens that we see, increasing in our region is exactly, the obesity. So there is a need for a dual-track approach, because if we are meeting in 2025 and the heads of state and the member states are going to discuss progress and we are off track, then we need to have a dual-track approach. And this is what we have been discussing with the member states. How do we go about the priorities? How do we accelerate progress? What is it that we need to do to get where we need to be? Because this is the commitment, and this is a commitment to the lives of the people who are basically more vulnerable, who are going to die, and who in the next crisis, whatever it be, are going to be the first ones to pay the price, the most vulnerables. So how are we going to get there? So this dual-track approach covers, first of all, dealing with immediate things. I mean, if we talk about alcohol consumption, this is a major risk factor for which we have evidence-based approaches that we know that if you increase taxation, reduce availability, and ban marketing, you will have huge gains in terms of life. WHO has done several studies on this. Alcohol has a huge impact in all-cause mortality and in life expectancy. You can lose years of life expectancy just linked to alcohol consumption, and it starts from very low levels. Then we have, other measures and other approaches that are needed. If we talk about the longer term, we need to have other types of approaches. And these are about generational shifts, and this is where obesity comes in. We need to look at the future generation, at the next generation, who is going to pay the high price of being subject to constant, what we call the commercial determinants that drive our behaviors. It's very nice to say that we have to live, healthy living. But if you do not have the money to pay, and we know that, in many countries, it's very difficult to access, healthy fruits, healthy vegetables. It's not there. It's cheaper. And again, who is paying the higher price? The most vulnerable. And they go and they are driven to these, vicious cycles of poverty, disease, and they will be caught in this process. So the future of the next generation and all the generations that are coming is compromised by things that are not within the control of the individual, because we know that the environment shape our behavior. And most of the diseases that we see are shaped by those determinants and are shaped by the behaviors and are linked to these determinants like alcohol, tobacco, physical inactivity, and they are, and nutrition. So they are shaping the way we are living today, and they are shaping the next generation. So we do need to start also addressing commercial determinants as a major determinant for the healthy living and for the prevention. And what we want to see, and the again, not only in the health systems and how we want to see our health systems being able to cover for the needs that we have, if you can decrease 50% of the burden by only preventing and, really addressing, this, then you will be supporting the continuation of a solidarity mechanism that needs to be there to support us all as we get older. So I would say, just to conclude, that, if we want to achieve progress, both being able to report in 2025 at UN high-level meeting, member states need to accelerate and need to really invest in putting in place those policies, which are many times very difficult, and I'm sure my next, my colleague is going to talk about this, very difficult to put in place because they are linked to other sectors. And you were talking about, health in all policies, and we have been arguing that now, actually, it's about health for all policies. Health for all policies. You cannot have any other policies if health is not put at the center. And this is the future that we are building today, and that really depends on us, because, new political cycles are coming, and if we want to see a change, it needs to come today. The healthy living is determined by what we do today, and building the next generation of people. And the health that we want to see and the systems and the burden that we want to see in the next generation will be determined by the action we do today. So thank you very much.
Yes, thank you, Karina. And with your passionately delivered thoughts, you have also very well described the objectives of the Healthier Together initiative of the Commission on Non-Communicable Diseases. Yes, I'm also curious there if you have suggestions or questions later on to Karina, so please note them down as well. But without further ado, the next speaker is Vesna Petric, who is Acting Director General of the Slovenian Directorate for Public Health and has previously acted as Head of Office for WHO Relations at the Slovenian Ministry of Health, as Chair and Co-Chair of numerous international committees on health and prevention. Dr. Petric has been a significant contributor to health strategy at national, regional, and world levels. Today's presentation, we are really curious what you are going to say, and you have the floor. Yes.
Thank you very much for the floor. And you see, I'm not anymore Director General at the Ministry of Health. I'm now advising ministers on how to work better with WHO and to really use this organization for us to perform better. I will first refer to what has been said a little bit because it's a great introduction to what I'm going to say later. We heard about, the importance of implementation and the best practices, and a lot was said about why we need to move faster. Action, it was said here, and yes, definitely, we know why, and we also know what needs to be done. It's clear, there's plenty of evidence there, but as it has been also said, we don't know how really. You referred, Michele, to political feasibility, which is actually political will, Is this a barrier that cannot be overcome? I don't think so. I think it's just a barrier. So as any barrier, this one can be overcome too, but we need to do something about it. And there was, about addressing commercial determinants of health. Yes, we need to address commercial determinants of health, but how are we doing this? Who is doing this? Who's responsible? Countries need to move. Who are the countries, actually? Is it the Ministry of Health minister? Is it the country as such, as member state of the WHO, European Commission? Who are the countries, I think it's us people. It's me sitting at the Ministry of Health for 30 years, and I'm a medical doctor. I sacrificed my wonderful medical career to work at the Ministry of Health for 30 years, to deal with 23 ministers, to start each time from zero, from the scratch, with, people who didn't trust me because I was from the former minister. So I had to really invest to make sure that these people realize I'm on their side. I just want to help. I studied in London. I was fortunate. I was sent out to study addiction in 90s. It was a very good time to study addiction, because HIV and AIDS at that time was a serious threat. Everybody was really upset, the governments, politicians, everybody. So what we learned then, it was that, we cannot confront such a challenge if we don't work with others. If we don't work with civil society, if we don't work with other sectors, police didn't allow for methadone maintenance. They didn't allow for needle exchange because they didn't understand it. So we had to overcome this barrier. Local communities, they didn't want to have abstinence programs with all the addicts in their local community. So we need to speak to local communities. And that was the best training ever for me. I learned so much from there. And in that time, Slovenia was doing a great job because they did trust professionals. They went for professional advice. And we installed all the harm reduction programs, and we succeeded with not having any epidemic in HIV in my country. One of the few countries, not in any group, even intravenous drug users, had only few cases, no epidemic. Why was it? Because we worked hand in hand with civil society. What does it mean, work hand in hand? Well, we finance them. We finance them. We gave them resources. We were working with them on the daily basis. I was walking with them on the street to see what's going on the streets, you know. We did some research together with them. So that actually was doing the how, you know, because we knew what we need to do, but we didn't know how, and we learned from civil society how actually you can address the needs, approach the most vulnerable, which of course are the addicts, the drug addicts also. So working in tobacco control later, it was even more about how. And it was even bigger challenge. Why it was bigger challenge? Because politicians in tobacco control were not so worried as they were in HIV and AIDS in 90s, you know. But there was opportunity. We had framework convention for tobacco control, so there was a lot of discussions at the international level. So there was an opportunity for us professionals to push it, to push the tobacco control agenda forward. But we had to deal with changing the social norms. So how can you do this? I was turning to health professionals. I said, back me please. I have to introduce, you know, total ban on smoking in all closed places. And I was told, oh, you are so radical, Vesna, don't do this, you know. I mean, not so many countries at the time did it, you know. Oh, don't speak of Ireland and Scandinavia. They are different culture, you know. So I turned to public health professionals, where there's not enough data yet. We know, you know, framework convention, but, you know, we have to take it step by step, okay? Not any good support there either. So I turned to my minister. I said, Minister, we have to do it. It's framework convention, so we have to implement. He said, no way, you know. Still, a couple of years ago, I was smoking in my office. You are going too fast, you know. So wait a little bit. Let's see what Austria is doing. You all know tobacco control and Austria, what they were doing, so I no need to say that we would wait for a very long time. Then suddenly a person appeared in my office, a young person, not even a health professional, a young student of a programmer, you know, IT professional. And he said, I want to do something for the public good. Wow, he was 19. I said, okay, let's go to medical students and talk to them because I know they are doing something. And he was very skilled in mobilizing youth because he was, when young, taking part in organized youth for different purposes, not for health. So he had these, you know, skills how to mobilize youth. He was actually helping me to get through, in 2007, total ban on smoking in all closed public health areas. And he also helped me in 2017 to introduce, not him, all the youth that he mobilized to introduce the measures such as plain packaging, licensing, and so on and so forth. So we were really going strong in tobacco control. It was not because of me, it was because of young people speaking to media, speaking to parliamentarians, you know, using the argumentation, it's for us young people. We work in bars and restaurants, you know. We are exposed to smoke all the time. We meet there. We, you know, in our free time, we meet there. We go to discotheques and dance in these enclosed places full of smoke. And that really mattered to politicians. So you can change political will. I mean, you can do something about it, but it's not me doing it. They don't listen to me. I'm just a civil servant, you know. But they do listen to young people if they are organized. They do listen to media. They are paying attention if the public is backing a measure that needs to be implemented. So we also did public pool investigations. And we ask people, you know, if they do agree with such a ban, that was introduced in tobacco control, not to smoke in restaurants and bars. And at the beginning, not so many were, you know, supportive, like around 50%. But after attention of media that was induced by young people talking to journalists, this changed a lot. So at the end, we had really big support, and we could prove that we have this support. So this was proven. It was, I was going around and telling everyone, showing these are the public pools, you know, this is what is happening. So this is how we actually change the minds of our politicians. What I'm trying to say is that the challenge of how in my country, but there is plenty of evidence on this in other countries too, so it's not just in my country, Slovenia, has proven to be addressed much better if working with civil society, in particular with organized young people. And when it comes to measures that affect young people, this is even more true. Now, there are many areas of work in public health where working with organized youth could bring us faster and better to results we are aiming for. One is advocacy, that I already mentioned, but when we speak of health literacy, you know, we say health literacy is so important, you know, people don't really understand how to use the health system and so on. There is also something that can be done so well by young people. Unfortunately, we don't have yet programs in schools to teach children, you know. We have financial literacy in schools already in Slovenia, but we don't have health literacy, you know. But we would wait for decades if these young people, you know, in primary school, for them to grow and really understand health literacy. But organized youth can do the job. They are very good in peer-to-peer, you know, education. They can tell other young people that are maybe not yet organized, you know, that what matters in health, in using health system, and they can help us there. It's not only health literacy, it's also something that we are speaking a lot about, commercial determinants, you know, what is done or not done by the industry. You know, that is a big challenge we are speaking of all the time. How to address this challenge? Well, young people in Slovenia are monitoring what the tobacco industry is doing on the ground. They came to me and they said, you know what? Now they are organizing parties. They get a girl and she is having a hat with cigarettes on, all sorts of cigarettes. So young people on the party, they can try cigarettes. I didn't believe them. Then they brought pictures. It's true. How can I enter homes and control what industry is doing in homes of young people? I cannot do this. But young people identified it, and they spread the message that this is not okay. You know, so these are the kind of things they can do, and I cannot do. Are these potentials of young organized people recognized by the public health professionals, ministries of health or ministers of health, health policies, decision makers in general, and national and international organizations? I'm not sure. Yesterday, I was attending the event on youth on global health. Some of you were there. I asked a question, how many, you know, from the ministries and WHO and OECD and I don't know which organization are here with us, young people? Only few. I think it was 4 or 5 people, including me, sitting there. I was amazed. These young people were talking to themselves. This is not how, you know, you people from these organizations I mentioned will learn about the potentials of young people. Thank you. So, the organized young people, they can contribute, also other civil society organizations, they can contribute. But this is only if us, you know, administration, let me say this, invest in them. It's very important that we understand that, you know, working with youth organizations, it's not only having them around the table, you know, when we feel it's like, you know, sexy, so, you know, to have them around the table, to listen a little bit to them and then claim they were around the table when we made decisions. They have much more potential, as I explained earlier. They can help us implement, they can help us raise awareness, and even they can help us with political will. So in Slovenia, what we did, we have been funding youth organizations through public tenders, working in health promotion and healthy lifestyle for decades. For decades, we have been funding youth organizations in Slovenia. First, we gave them peanuts, like 5,000 euro here and there, and then we started to finance them really well, €500,000, for their projects and programs. We have learned that investing means not only ensuring financial resources, but also ensuring that they work with professionals when developing their approaches. It's seriously very important because what they do should be evidence-based and should be effective. So the OECD could look at it and say, good practice, fine. We have also learned that it is crucial to make them join international networks. This is so empowering. But for this, they need resources. I mean, they cannot travel without resources, So we need to invest also in this. Not only networks of organized medical and pharmaceutical students, but also public health network of civil society working in tobacco control, alcohol policy, environment and health, and so on, like Movendi International in alcohol policy. Our youth is constantly working with them. We encourage them to participate in initiatives of EU meant for young people in general, not just for health, because they should learn how to influence, and impact policies. At the beginning, we offered trainings in advocacy, but later on, they were much better in this than I was. I spent several weekends when I was younger with them in remote areas where they gathered, to explain what advocacy is. No need for this anymore. In Slovenia, they are very skilled. We invited them to represent youth in the working groups and commissions at the Ministry of Health on tobacco control and other areas of public health, so they could be around the table, but that was only one thing among many. And we encouraged them to apply for international funding also, commission. They were there, to get your funding. Eventually, this resulted in them being strong, even recognized and awarded by organizations such as European Commission and World Health Organization. We have a wonderful organization, No Excuse, which doesn't mean no excuse to smoking, no excuse to alcohol, but no excuse not to be informed about what is going on, who the stakeholders are, who is pushing smoking on us to earn money, this kind of no excuse. They were thus encouraged to internationalize their engagements. They first developed an organization, APYN, which was Alcohol Policy Youth Network. It was international, but then they thought alcohol is only one area. So now they developed Youth Health Organization. It was started in Slovenia. Now it has more than 60 international partners from all around the globe, from Canada, Brazil, Georgia, name it. So they are really going strong. So I can say all the investments paid off. All our investments, my colleagues' investments paid off. Now, to conclude this, I'll quickly start to conclude. We believe that investing in organized youth and civil society in general is a must if we want to be more successful with what we are after in healthy living and health promotion, but also in UHC. You all know what is going on there, and other policies that we are adopting and aiming for their implementation. That is why Slovenia, together with some other countries, Thailand, Norway, France, Brazil, and Tunisia, to mention a few, is promoting adoption of the resolution on social participation in the next World Health Assembly in May 2024. We want to ensure that the policies we are developing get implemented also by meaningfully involving civil society, including youth. For this, we need to invest in their capacities, provide trainings, ensure that what they do is evidence-based and recognized, and most of all, involve them in all parts of policy making, decision-making, planning, implementing, evaluating, and improving after evaluation. This goes alike for the member states, but also for the European Commission, I think, and the WHO, and other international players in public health. Let me say the final thing. The meaningfully involving organized youth is a process that requires investments and dedication of our governments and international organizations. It needs people to understand and promote social participation of civil society and also youth. I did it out of necessity, as you heard, because I couldn't do it otherwise. You can do it out of understanding the potential of these organizations. If we fail to engage them, others will. Yes.
Yes, thank you very much, Vesna. What a fantastic initiative to get young people involved. I see we have also a couple of young people in the room. Maybe you let us know afterwards your opinion on this, on what could be done at national, but also at international. Vesna was also referring to WHO and the Commission. What indeed could be done? Yeah, because we are moving and we are quite open to get citizens and also young people more involved. We just had the European Year of Youth, actually, and I participated myself in some of the discussions with young people, and I know it's a very interesting approach which also offers new approaches to be successful in public health. So thank you very much, Vesna. And that brings us to our final speaker, who will actually talk about health literacy. Vesna was referring to that. So our final speaker is Susanne Melin. She is Program Director at the Bosch Health Campus of the Robert Bosch Foundation. She joined the Bosch Foundation in 2003 and has been managing grants and programs around NCDs for many years. Since 2016, Susanne is responsible for the Foundation's funding activities around health literacy and patient empowerment. She was, among other things, involved in the development of the German National Action Plan on health literacy, and will be presenting today on the subject of healthy living and prevention through health literacy. Susanne, the floor is yours.
Well, thank you, Stefan, for the kind introduction and for the opportunity to speak on this panel. Thank you also to my previous speakers for sharing their insights, and to Vesna for paving the way for introducing the concept of health literacy. Yes, I don't think anybody in this room needs to be convinced of the importance of prevention. We have just now heard some of the key aspects reiterated. I'll just repeat them very briefly. The ever-growing increase in non-communicable diseases, especially those that are lifestyle-related, not just in absolute numbers, but also as a growing proportion of the burden of disease. The importance of prevention health promotion in order to prevent individual suffering and to enhance individual well-being, but also the importance of prevention in order to keep our societies going and to make our healthcare systems in particular more cost-effective and sustainable, especially with regard to the growing challenges in many countries around the world, which is not just NCDs themselves, but also aging populations, shortages of healthcare workers, higher cost pressure on healthcare systems, and the like. Before I continue, let me just stress 2 points that seem to me important about prevention. While this session is primarily about children and young people, let me just stress that prevention is highly important throughout the entire life course, from childhood through adulthood into old age. It is never too late for preventive measures and changes in lifestyle that enhance people's well-being. And closely related to this is my other point. Prevention is not only important as primary prevention in order to prevent NCDs entirely, but also plays an important role for those already displaying risk factors or preconditions, and even for those already living with an NCD, in order to improve quality of life and to avoid complications or secondary problems. Indeed, you could argue that, if anything, life with an NCD makes preventive measures even more important. A young diabetes patient once told me, I have to follow a healthier lifestyle than all the healthy people. So measures that traditionally are considered to be about prevention get ever more important. But now for the key part of my statement, I would like to draw your attention to the importance of health literacy as a tool for healthy living and prevention, as something that can actually be done. There are many definitions of health literacy but they have a lot in common and are generally about the ability to access, understand, appraise, and apply health information in order to make health-related decisions. Now, we all know that many of our everyday decisions, especially those concerning nutrition, exercise, sleep, stress management, and so on, influence our health status. So the ability to make all these decisions, informed decisions, can play a crucial part in adjusting lifestyles and thereby preventing lifestyle-associated NCDs. And indeed, we do know that health literacy is linked to both health behavior and health outcomes. Awareness for the importance of health literacy has risen considerably over the last decades, and I think this is rooted in the fact that health literacy is in fact an approach to cope with various very visible and widespread challenges. The aforementioned increase of NCDs is one of these challenges, but a second challenge is the digital transformation, with digital technologies leading to a sharp increase in available information and data. On the one hand, of course, it is great that we have all this information just one mouse click away today. But the quality of all this information is mixed, and while good and reliable information certainly exists out there, it is hard to find, hard to identify, and hard to access for too many people. The sheer mass of information is a problem in itself, a health risk even, by creating confusion and mistrust and by affecting people's mental health, something for which the term infodemic has been coined. So we need health literacy to deal with both the quantity and also the mixed quality of health information available today. Thirdly, health literacy is, I would say, both the cause and the necessary consequence of the change in power relationships between experts and lay people, addressed, for example, under the labels of patient empowerment or shared decision-making. And this, in turn, is connected with a shift of assignment of responsibility to lay people, to the point where NCDs are considered, you could say, almost self-inflicted, and health literacy as a mere personal, individual responsibility. But this must not deceive us into overlooking the strong structural and context factors that play into this, that have already been mentioned by the other speakers. So health literacy is not only situation-specific, it is also affected by more general social and relational dimensions. People can only act in health-literate ways to the extent that the surrounding structures allow and enable them to do. For example, by making health-related information accessible and understandable, by enabling and supporting decision-making, and so on. And this goes way beyond the scope of healthcare itself in the narrow sense. Just as, and we already heard about this, health and well-being are produced in all areas of life, so is health literacy. Health literacy is shaped by everyday conditions and should therefore be promoted in all our living environments and in daily life. It is important, for example, that schools and other educational systems support and foster health literacy, as was already mentioned as well. It is important that consumer choices can actually be informed choices and not be hindered and skewed by the marketing power and commercial interest of industries like the food industry or the leisure industry. It is also important that the media act as facilitators in handling health information. This, of course, the importance of enabling and fostering health literacy, of course, continues on all levels of the healthcare system itself, from healthcare professionals to healthcare organizations to political processes. And all this means that health literacy, as well as prevention, health promotion, well-being in general, demands a systems perspective. Just as health needs to be fostered and promoted by all policies, be they about education, workplace, mobility, living conditions, and so on, so does health literacy. So you could say that this is not just a call for health in all policies, but also for health literacy in all, or at least in many policies. Now, the last challenge I would like to mention that makes health literacy so important, but by no means the least, health literacy can potentially be a promising means to address and to reduce health inequity. We do know that not only health outcomes, but also levels of health literacy are unevenly distributed and follow socioeconomic determinants. Personal knowledge and competencies depend on surrounding structures and availability of resources. People with, for example, a lower income or lower levels of formal education also show lower levels of health literacy, just as they show poorer health status and shorter life expectancy. The importance of health literacy, I would say, is in large parts due to the potential of health literacy to understand both individual and group differences. And while health literacy cannot do away with many of the roots of unequally distributed health opportunities and health outcomes, it can help balance some of these and thereby reduce health inequity. But of course, only if the problem is addressed accordingly. So we need to develop interventions and redesign structures so that disadvantaged and marginalized groups benefit from them especially, and not, as also was already mentioned, just design programs that enable people within the same bubble to talk to themselves. Right now, so what is actually happening globally in the field of health literacy? So the concept of health literacy, I would say, was mostly developed in Western countries, but it has by now reached global significance with thousands of scientific publications worldwide and the adoption by both governmental and non-governmental agencies and organizations in their policies and agendas. The most prominent of these, I would say, is the World Health Organization's Shanghai Declaration from 2016, in which health literacy is stressed as one of the 3 pillars of health promotion. Last year, the WHO also launched a report on health literacy development for the prevention and control of NCDs, there we have the NCDs again, with a series of global case studies from national health literacy demonstration projects across the globe. On country level, health literacy is being promoted, for example, by national action plans for health literacy, which countries such as the United States, Scotland, Portugal, or Germany have adopted. And experience shows that these action plans do not just sit in drawers or on shelves, something I had been afraid of before we got involved with the German National Action Plan, but that there are, in fact, trickle-down effects into other guidelines and frameworks, for example, disease-specific ones, into cancer guidelines or whatever. And we also see that health literacy responsibilities are assigned within authorities. So the progress is still slow, but there is progress, I would say. Now, what can countries learn from each other? They can learn via, for example, the WHO's initiatives or through other countries' experiences with national action plans and other frameworks. And at the same time, it is important to take into account that countries and communities have different ways in which knowledge is produced, in which knowledge is exchanged, information is transferred. So a global perspective means that at the same time, different strategies will be needed to actually apply health literacy concepts in different cultures and settings, and that engagement with local communities, with the civil society, is needed to develop appropriate strategies. So let me conclude by stressing again that there is a general responsibility of systems, of societies and organizations to make evidence-based health-related information more accessible and easier to act upon, both in the digital world and in the real world, and especially for marginalized and disadvantaged groups. And I would like to finish by quoting health literacy champion Christine Sørensen, who's at the World Health Summit as well. Maybe some of you have spoken to her. The health literacy deficit is a public health challenge we cannot neglect. Health literacy in all its facets needs to be recognized by the world community to develop health for all across the lifespan. Thank you for your attention.
Yes, thank you, Susanne. That's really also a very important subject, and also we in the Commission try to make a contribution. For example, we have a code against cancer, which will be updated as part of the Beating Cancer Plan, and there will be a new code for mental health as part of the Mental Health Initiative. Okay, so now we can come to the question and answers, and I think we have a mobile microphone. Ah, yes, and I see already some hands, very good. Please first tell us who you are, who you represent, and then which of the speakers should be responding to your question. Let's start in the middle here. We have half an hour, so that's good if so many people have questions.
I'll try to be fast. Francesco Florindi, Thermo Fisher Scientific, Brussels. I used to be a patient advocate before. I used to work in academia as well. And I worked a little bit for the European Commission as well, Stefan, so JRC, underrepresented. My question is concerning the innovation side of prevention. So Mr. Cecchini, you mentioned very well the economic burden of disease. And Mrs. Ferreira, you also discussed a little bit about the innovation. We fully recognize the vast impact of health determinants in terms of exposure, commercial determinants, and so on. Genomics plays also a huge part in NCDs. We know that 25% of the health outcomes in NCDs are directly linked to genomics. Now, in answering my question, I hope that you consider what Vesna said before. Once upon a time, no one would even consider stop smoking because the rich countries could afford it and the poor ones not. My question to you is the following. We know that genomics can help. We have plenty of examples that approaches like predictive genomics can improve, change behaviors of people. My question to you is, what are your suggestions to startups, to researchers and companies working in this field to approach not just low-middle income, not just rich countries, but also low-middle income countries with solutions that can be powerful? The last thing I want to say is that the Commission itself and the Belgian and the Spanish presidency are investing heavily in this precision prevention approach. My fear is that rich countries are going to move fast into implementation in the coming years, and the rest of the world falls behind. How can we avoid that? Thank you.
Who would like to reply? Carina?
So maybe I'll start on the innovation, and I would like to bring this to the needs of improving the way we work together, because again, many of these innovative approaches require, require a different type of approach, which is a collaborative approach, so that we do not develop things that cannot be implemented and also that have that potential but can only be used by a certain amount of people and not everybody. So innovation is very important, but needs to be contextualized, and there is a lot of potential. I think not only in genomics but also using artificial intelligence. If we look at also the potential of artificial intelligence to change behaviors, this is something that is being also explored, and that seems very promising, using some tools that we know can change the way you perceive the reality, and that can have an impact in changing the behavior, for example. So these are, personalized, type of tools that can be used. But again, how can we do in a way that we give access, that we provide access to all that will need this type of tools that can be available. So partnerships are extremely important, and also, situating this, in a way where, again, if, and pardon me if I bring it back to the commercial determinants, we have quite a lot of innovative approaches. We know that, working on childhood obesity, there's a lot of things that can be done to prevent, this catastrophe that we are seeing. And yet, even by having those innovations, we are not able to implement. And Vesna was saying, it's nice to have all these tools, but can we really, implement it? What are the, and we, it's a low-hanging fruits, what are the quick buys that we can have to really make this work? And there's so much that we can do today, not just thinking about the future, today, that we are not doing, that we are being preventing. And you cannot address you cannot address childhood obesity and bring all the tools that we have today if you do not address, things like, these commercial determinants. Because governments try to implement some of these innovations, but they are, constantly being sent to, trial, to courts, right, where they have to respond. Why is it that they're protecting the health of their populations? So I think innovation is very important, but we need to contextualize into a broader perspective on how we want to put health in the center of all the things that we're doing, and again bringing to a very important area of work that WHO has been fostering, which is about an economy of well-being. So centering this in another type of narrative that needs to be there so that all can benefit from the potential that we have in the society and the great tools that are being developed now that we have so much knowledge among us. But we are not making progress. And we need to, for that, we need to put health in all policies, and we need to address those commercial determinants and turn the economies into a different type of approach, which is non-harmful, but rather health-oriented approaches. Thank you.
Thank you very much, Karina. Let's do the other side here.
Hi, I'm Alexandra. I'm a youth delegate here. And since you asked for issues to point out, I would like to point out an issue that affects, well, kind of all of us, but especially dangerously children and young people. And we rarely talk about it. It's an addiction. It's social media addiction. And it affects our sleep, our relationships, our ability to learn, and both our physical and mental health. And we don't sell tobacco or alcohol to children, but still we expose them to social media as if it was not dangerous at all. And so my question to you is, how are you and how do you advise other policymakers to assist us in fighting for regulations that protect us from social media and other dangerous technologies?
Thank you very much for that question. Who would like to reply? Vesna.
I can try answering this. Yes, that is really worrying. But, it's to be addressed appropriately would need, as I said before, a lot of investments. Where are we going to invest? We can actually invest in young people. How they spend their time, it's crucial here. But if what is available to them costs, that is one of the obstacles for them to engage in sport activities, dancing, painting, whatever. If you have to pay for everything, like children attending this kind of activities and their parents paying for it, that is not okay, because some young people are left out of being able to engage in this kind of creative activities, if I would call them so. Then you have to also invest in spaces where people will meet, Then, of course, you were discussing the legislation, but that is difficult because that is legislation that needs to be international. My country cannot really ban, even advertising through social media, we cannot ban really, because that doesn't work yet. Maybe it will. So I think that, we should actually start thinking how to make sure that young people have something that they can do and that they can engage in that is as attractive. That is really important. But the other thing that is also seriously important is their parents. How are we dealing with parents nowadays? They work for 10 hours very often. They have no time to engage with their children. They come home, they are super tired, and they really appreciate that the child is on the telephone or whatever, So I've seen families sitting around the table in a hotel where I was having my holidays, and the little child, not even able to speak, had in front of him, comics on the phone, so that parents could relax and eat in peace. It's seriously really wrong, but that is how we are living nowadays. So that would really need a lot of thinking, how we are organized as societies. It's not just about bans. It's about, well-being and, have some time to engage with children and give them some space to engage among themselves in a ways that they would appreciate. That is how I see it.
Yes, thank you. Yes, please, Michele.
And it's a follow-up question to Vesna, probably. I was fascinated when you started talking. During your talk, you mentioned all the movement with young people. Do you think that on social media we could have a similar type of movement as 30 years ago it was for tobacco?
Definitely I do, because the program I was speaking of, No Excuse, is also already digging into this for some years now. It's peer-to-peer, so it's working with other children, those children that are more interested, getting organized, but then working with other children in schools, engaging them into different activities and discussing with them, these problems. So awareness among children that there is something wrong if they are all the day on the phone, and that there may be some other options for them there, that they should try out is very important. Anyway, I think it's broader than that. I think this is really much more complex than tobacco control.
Yes, thank you very much. And maybe somebody from that side there.
Is it me? Oh, okay, thank you very much. I'm Julia, I'm from Slovenia, and I'm representing Youth Health Organization here. There's many things I want to say, but I would like to thank Vesna for her work and what she addressed here. I would further like to highlight the importance of youth work because I have a background also in No Excuse organization as well as other youth organizations. And I see the importance in having that relationship with young people and children because they trust young people usually more than some people who they don't know or, adults. So through this relationship, I think this is a great tool to bring the knowledge that you have probably through those networks of young people directly to those who need it most. So this would be my suggestion. And a question is if you have any advice on how to work better with governments or other, with governments to implement the changes that are needed. Because yes, we can gather on streets or on social media and on other places, but sometimes it takes a lot of energy, and maybe it would be easier for some decisions to be taken through other ways. So this is a question for anyone. Thank you.
Thank you very much for the suggestion. And as far as how to better work with governments, who would like to comment on that?
Can I maybe just say, give you two examples of concrete ways of working and how we appreciate working with youth? Because as Vesna was saying, I mean, this is where we have to be investing. So I'll give you two examples. One on the alcohol labeling agenda. So alcoholic beverages have, I don't know how much you know about this, but maybe you don't know. I mean, I was surprised to understand that most people do not know. A bottle of water has more information in terms of nutrition value, ingredients, and any information than a bottle of wine. Okay, or beer. So alcoholic beverages are not labeled and do not have this kind of ingredients, list or the harms that they can cause. And therefore, we have been working with young people to co-create how alcohol labeling could look like. So it is a way of building that literacy because, again, how can you choose if you're not even aware of what is inside a bottle of what you're drinking? So how can you make a decision if you're not aware first? So then, if you are aware and if you know, then you are informed, then you can make a decision. But we've been working with co-creating how alcohol labeling would look like, from young people's perspective. So what would be important to have there? And then the second example, so doing this, the second example is by working with young people WHO has developed a tool. To work with artificial intelligence, you need to program, you need to have the information. So we're working with young people to collect through their phones, images of how, because you were saying we don't sell alcohol to children. Unfortunately, we do sell alcohol to children and tobacco. It's very unfortunate, but it happens in the digital, environments. So we are collecting that evidence, working together with young people that can give us the photos so that we can train the tools to detect this and be more actively engaging, and putting in place regulatory mechanisms to prevent that children are targeted when they should not be, because this is a matter of protecting their rights. So we are doing that, and we are very grateful to have the young people working in these, innovative ways of really, creating those mechanisms that can run faster, that can support the regulation in place to take measures, quicker than they are usually doing. So if we train those tools, artificial intelligence, if we train them, they can be quicker and they can prevent, they can provide this information to Ministry of Health and to the governments where they have these mechanisms in place. So we're very happy that we can do this together. Thank you.
Yes,
I just have to complete this because, Julia, working with governments, what do you mean? You are working with our government already. For example, you are doing the mystery shopping.
Yes.
And you are the ones who make us, do our inspections more successful. Because without you, it looked like everything is fine. Nobody is selling tobacco products to youth. But with you, with your organization and mystery shopping, we realized 95% tobacco products were sold to young people. What we did then, after government, we adopted legislation, introduced labeling, and now we are licensing, and now we are taking the license if they are violating the law. You worked with the government in that, and you are working with the government now. We are trying to introduce, ban on all the flavors in the vaping devices, It's really tough because Ministry of Finance doesn't want it. Ministry of Finance doesn't want, we know where it comes from, of course. But you are doing the job now because you went to media, you informed media that is all about children, imposing the vaping machines on children with the flavor of, strawberry and those things, You are already doing it. Thank you.
Thank you very much. Yeah, very interesting. Yes, and please, you have the microphone.
Thank you. I'm representing the Conference of International NGOs at the Council of Europe here, and I'm a nephrologist by training. One of the things, we have heard very good reports on working with young people in the areas, although I would wish that it would also address the fast food consumption by young people. But one of the things that I'm aware of is that the people who really control the nutrition of families are the mothers, their grandmothers. They're the people who shop, they're the people who do the cooking, they're the people who train their children what's good to eat and what's not to eat. And I was very impressed, President, by your talk about how you work with organizations, researching with them, walking with them, and financing. And I would like to ask Michele if the OECD actually do work with civil society, or do you only work with governments? Because often women's organizations and NGOs that are voluntary do not have resources to be able to do that research, to be able to influence people, be able to network internationally, which you mentioned as very important, and to improve the health literacy. So I would like to see more support for civil society in improving healthy living and prevention in nutrition terms. Thank you.
Thank you very much, Michele.
A quick reply on this, yes, definitely. OECD does work with civil society and other stakeholders when we carry out our work. Let me give you two examples, very practical. So the first one, you may have heard that OECD has launched and at the beginning of next year is going to present for the first time the results from the first wave of the Paris Initiative, which is an initiative that tries to collect the quality of life and how healthcare services impact and promote quality of life of people. The questionnaire that were sent out to countries participating to this attempt were co-developed with civil society. Is one of the group that were consulting throughout the process, provided inputs, and were involved. For work on public health, every year we have what we call the expert group on the economics of public health. It's a working party that brings together both delegates from member countries as well as civil society. And they participate to the meeting. We discuss the work we are doing and the next steps.
Thank you very much. And Susanne also wanted to
just to add to this, I'm fully on the side of engaging civil society, but let us not be deceived into pushing responsibility to individuals where we need structural reforms. It's not just the mothers and grandmothers it's responsible, it's the food industry. When I see, for example, there's a discussion in Germany at the moment about banning TV ads directed at children and young people for unhealthy food, highly processed food, rich in fats and sugars. And the food industry is lobbying hard to prevent this ban from coming, and so far it's not been put into a legal framework. And the sluggishness with which sugar taxes are being introduced all over the world, or the problems around labeling foods as to their healthiness. I mean, again, experiences in Germany show it is such uphill work. So we have labeling now, but it is not obligatory. Food industry can choose themselves whether they want to put this on their packaging or not. And it's also deceitful because, for example, a pizza with a green label just means it's healthier than other pizzas, but it's not a green label that's being assigned in comparison to an apple. So people are sort of tricked into believing that if they eat this pizza, they eat a healthy item of food, which they don't compare to an apple. And I just want to warn us all to not fall into the trap of assigning individual responsibility where we need structural reforms.
Yeah, and we have 3 minutes left, so Vesna for the last word.
I just have, because I know there are many questions on financing, you know, how NGOs can be financed, and you have to have a very clear picture here. You know, it's very important to understand that WHO and the OECD, what they can do, and we should ask them to do this, they can technically support NGOs so that they have all the knowledge, so that they have, that they increase their capacities to be able to apply, you know, for the funding. The funding is in, let's start with local communities. The funding is at the national levels, and there are different resources, but you have to be able, you know, to apply for this funding. And then the funding is with the European Commission. There's plenty of money there, so let's go for it. But you have to have capacities to do so. And I think responsibility here is with WHO and the OECD to empower the NGOs as well to be able, with evidence, with all these things, you know, to be able to apply for these resources.
Vesna, I take your point. I'm sure that I'm speaking also for Karina, but for us, civil society, NGO, particularly those on the ground, are a huge resource. When we discuss with government, with countries, for example, the implementation of a practice, of a policy, and so on, we count very often on local, national level NGOs to help spread our voice as well. So to that extent, I think they will find an open door, certainly for the OECD, and I'm sure also WHO.
Of course.
I was speaking of investments.
Yes, thank you very much. I think we are at the very end. And if you want to know what the Commission does for civil society, talk to me afterwards. But now I think we have to close the session. I would like to say thank you to our 4 excellent speakers for their very motivating and insightful thoughts, and all of you for this really interesting debate. I think it became clear that there is both the need and the opportunity for better policies to promote healthy living and prevention. So thank you very, very much. With that, I close the debate. But before you leave, I would like to announce also that the European Commission is actually organizing a session at the World Health Summit, which is not in the program. That's at 4 o'clock from 4 to 5:30. It's about the implementation of the regulation on serious cross-border health threats, which is new and which is the result of a learning process from the pandemic. So if anybody is interested, at 4 o'clock in room Cairo. Okay. So with that, you are free to go to lunch. Thank you very much again.